This is McKinley County. 90% of its population belongs to a minority group, with 75% being Native American. As of August 2020, its death rate per capita due to COVID-19 is 6th in the entire country. This is Gallic City. Its poverty rate is double the national average, with 3 out of every 10 people considered impoverished by the U.S. Census. It has the second highest COVID death rate per capita. And here is Truesdale County. With a high school dropout rate of 2 in every 10 adults, that's higher than nearly 85% of the United States, first nationwide in the number of cases per person. This trend of socially vulnerable populations being disproportionately affected by COVID-19 is reflected across the U.S. and connects to the larger issues of healthcare access, education, and demographics. That's why we developed Access and Equity, the COVID-19 Health Vulnerability Mapper, a web application that doesn't just tell you about this social disparity, but illustrates it geographically by letting you explore the realities of health inequity yourself. Every county in the U.S. is represented by one of these bars whose height corresponds to your selected COVID statistic, and whose color corresponds to your selected metric of the CDC's Social Vulnerability Index, also known as SVI, with census variables like socioeconomic status, language skills, and minority population. We've also included measurements like high school graduation rate and vehicle ownership, some of which have surprising correlations with COVID-19. By searching for a county, or by simply clicking on one of the bars on the map, you can access information about that county, including its social vulnerability, its current COVID status, the relationship between these two metrics, and how both of these values compare to other U.S. counties. While there's been quite a bit of media attention around social disparity during this pandemic, we saw a lack of real, data-driven, interactive, and geographic tools that show people how and where this issue really plays out on the national stage. To this end, we've implemented several powerful technologies to deliver real-time COVID status along with the latest social vulnerability metrics from the CDC. Our viral statistics are updated daily from AWS Data Exchange, where we've leveraged every data point in the Enigma Daily COVID U.S. Counties database. We use AWS CloudWatch and Lambda to provide automated processing for the 400,000 lines of data we retrieve every day, which we store through S3 and deliver to the user through our Elastic Beanstalk server. The final visualization is then powered through Mapbox and C3.js. For a more intuitive viewing experience, we've used linear scaling to normalize our visualizations. When you search for or select a county, you can explore graphs that highlight the significant relationships between disparity and disease. Here, every county is plotted as a point, with the current county highlighted and the trend line overlaid. Depending on the metrics you select, the scatter plot will change to reflect that. In our analysis, we found a strong correlation amongst SVI and COVID-19, particularly between deaths per capita and minority status. Together, the trend lines and percentile scores of each county serve as indicators of patterns in the data. On select vulnerability measurements, we also include a pie chart, if applicable. Going forward, we're excited to use our tool to partner with nonprofits, governments, and other organizations to spot and solve health inequity. To this end, we're in the works of adding more analytical features, more metrics, and a time series illustrating data over time. Our application presents an easy and engaging way of exploring COVID-19 data while directly visualizing the health disparities found in communities of differing socioeconomic positions. More importantly, we hope that this solution will inspire others to explore, investigate, and take action against health inequity in their own communities. As student activists ourselves, we recognize the severity of these issues and the timeliness of change. We hope this hackathon can act as a platform for us to gain momentum. To help out, we've compiled a repository of resources here on the web app and on our website to address health inequity in communities like McKinley, Truesdale, and countless others. The COVID-19 Health Vulnerability Mapper for the explorer and changemaker in all of us.